This is Dr. Andy Corin, the Mendocino County Public Health Officer, and I'm excited to be present at this historic occasion of the first Pfizer COVID vaccines here in Mendocino County. We've just witnessed the opening of the sub-zero box, and we're about to start giving some of those vaccines here. I want to thank first CEO Carmel Angelo, who's the CEO of Mendocino County, and has encouraged our entire team to work closely together to protect and to serve the residents of Mendocino County. I also want to thank the director of our Health and Social Services Agency, Becky Emery, and her staff of swabbers, contact investigators, contact tracers, the call center, and all of our clinics who are frontline managing patients who have symptoms and doing the testing, as well as EMS and especially Dr. Mark Luato, who is also caring for us and planning for all of these major events. And in particular, our hospital partners from Adventist Health, CEO Jason Wells, who is here, Dr. Basant Parker, the Chief Medical Officer, and who's not here today is William Miller, Chief Medical Officer over on the Coast Clinic, and especially want to thank the housekeepers, the food service workers, who are not usually in front of the cameras. They are always working. They never take a day off. These are our essential workers, and we thank them along with the doctors and the nurses. It's important to understand that these vaccines will be distributed according to an ethical and equitable framework that has been developed through the CDC and California Department of Public Health, and which we're sticking strictly to. It includes all of those people that I've mentioned, and we're here because, remember, of this terrible pandemic that has claimed 24 lives here in Mendocino County. Over 2,000 people have suffered from the illness here, and everyone has suffered from the economic loss, social problems, psychological suffering throughout our county, our state, and our land. There is a light at the end of the tunnel, and we hope that this vaccine will be it. It will be months, however, before herd immunity can protect us all. And even those of us who get the vaccines, first, second, or third, will need to have a second vaccine, and they will not be protected, probably for a month after that. In addition, we won't have enough people vaccinated that we can rely on the vaccines as our protection. Everyone must continue to keep masked, keep their social distances, whatever ventilation we can have, wherever you are, washing your hands and using the sanitizer, and avoiding gatherings, which is probably going to be the most painful during this holiday season. But this is the first step to recovering the health in our community. So I now want to turn it over to Dr. Basant Parker, the Chief Medical Officer of Adventist Health in Ukiah Valley.
Thank you, Dr. Andy Corin, and thank you to the county for the wonderful partnership with Adventist Health. Here in Adventist Health, we have taken care of over 200 inpatients with COVID. Currently, we have 13 COVID patients in our hospital, and we have about 30% ICU capacity. You can all tell that this pandemic has had quite an effect on all of us, and it is a breath of fresh air that we now have the vaccine in our county to be able to give to our essential workers, and hopefully in the next few weeks to months to the rest of the community. So that's a very good thing, and we are happy for that. I want to thank our frontline employees who are taking care of these COVID patients. We have done multiple tests, and the hope is that as we get the vaccine underway and we continue to mask, we will be able to keep COVID levels down in our county and be able to take care of the few that would end up with COVID. But it is a great thing that we have the vaccine here, and with that, I'll pass it on to CEO Jason Wells.
Thank you, Basant. We want to thank the community. You have helped us flatten the curve through this pandemic. We got nervous. We had 17 COVID inpatients back about 2.5 months ago. And we haven't hit that 17 again, but we did hit 15 recently. And so we've seen the numbers, the positive tests are going up significantly. And so it's so important that we continue to mask up. Thank you for taking care of our incredible precious resource, our frontline caregivers. This is EMS workers, people that drive our ambulances, people that are serving in our emergency departments, people are serving in our clinics with our FQHC partners. And you think of Mendocino Community Health Centers and the work they're doing on the front line. We have health workers with the county. We have our street medicine program. And we have, of course, 1,300 team members with Adventist Health in our 3 hospitals and 24 clinics. I want to say thank you to you for your resiliency through this, for coming to work each and every day in spite of this pandemic, worried about taking it home to your families. You've done an incredible job. We're still in the middle of this. This vaccine is a breath of fresh air. It's something we've long awaited for. We are about to vaccinate the first people in Mendocino County. We have physicians that are going to take part in that. We have nurses. We have housekeepers. We have people that, like I said, deliver food to patients, people that serve in clinics, people that do swabbing with the county. And so we have picked a beautiful cross-section of this community, and today marks day 1 when we start getting this vaccine out. So I want to thank Carmel Angelo, her leadership. I want to thank Dr. Andy Corin, his leadership, and just our county partners and everyone on the front line of this pandemic. Thank you for wearing your masks, and we're sure eager to get right to doing these first vaccinations. Thanks for being with us.
I'm pleased to share that all 975 vaccines will be going as first doses, with the follow-up of the second dose to come in 21 days to these individuals. All 975, again, are going to those individuals in the category of the phase 1A and the tier, aligning with the CDC guidance, and we want to ensure that we are continuing to keep our frontline healthcare workers available to support our community in this critical time. In these efforts, we appreciate everybody's support and adherence to social distancing, keeping our 6 feet away, wearing our masks, and making sure that we're doing everything we can to keep everybody safe. And this vaccine is just the next step as we move through this pandemic. And so thank you very much for your partnership in these efforts. And with that, we'll turn to our first doses.
Quiet. It's like a celebration, guys.
We're super excited.
Here we go. This is awesome, you guys. This is something we've waited a long time for. That is awesome. Dr. Mark Ukiah, well done. Well done. So brave, you didn't pass out.
I'm not gonna guess. Even cheer up.
Oh, you're so brave.
Yay.
That is awesome.
How you
feel? Okay.
All right,
Holly is one of our amazing RNs up at Howard. 5 years. He's going to talk about his shot on his radio show next. So brave. Be brave. That is awesome.
Oh, did great.
Great.
Yay.
Well done. Well done, Marcella. That's awesome. Angel, you bet.
You have the cutest voice, but I can't hear you. Angel, are you ready? I'm ready. I'm always ready. I've been ready.
They're also emergency central organization. And I don't know the directly essentially exact numbers for each of them. But it will be here, it'll be around the county, the other emergency service workers, clinics, and some.
I think my family's all ready for me to have this.
Dr. Parker, could you talk to us a bit about what the vaccine is, how it works, a little bit of that background?
All right, so this is the Pfizer vaccine.
That's fine. That's easy.
Frank's fine.
Is given in 2 doses. We test one dose, we give it 2 doses,
Oh.
getting it now. And the second one will be another 21 days from first dose. And this is a vaccine.
Go Angel.
That you have a segment of
Perfect.
virus.
Angels on the OptumServe team, 400 COVID tests a day.
System, so it's not the virus. It's all getting
Thank you so much.
Thank you, Angel.
that will set into the system. Now, it does not get
Yeah, you just hand it to them and they'll give you the
center of the
paperwork.
cell, because when it was DNA, it does not get into that and get integrated. That's the DNA.
Hi there.
That's not
Just sit down.
goes into the cell, it stays on the outside of the center.
Is this Devin? Devin? Perfect. Devin is a medic with MedStar on the front line.
Production, choose that out on the outside.
Thank you, Devin. Well done.
And then,
Didn't phase. Tough. Love it.
it seems to be like a virus. It's a second
Thank you, guys.
Well done.
Thanks for doing this.
Hey, thank you.
antibodies that will protect you.
Yeah.
It's tricking your immune system to think that there's a virus outside.
I'm excited.
Virus protein that simulates
Are you
That's
excited,
awesome,
Brad?
Dad. Thank you.
Oh, thank you guys.
response
Thanks for all the work.
Oh, come on, this is awesome. Think of the millions of hours that went into making this vaccine on this timeline.
My sister works for NIRA.
Oh, wow.
And she said, I said, well, I work with.
So this is Brad?
He says, he's like, I'll be skeptical.
So Brad has worked in our ER for 17 years.
17 years.
Soon, in the next couple months, it's working on the vaccination. It's awesome.
So I started.
Is that what we're doing? But I was like,
So the vaccine is currently and so we think that this likely to get by the end of the year. Yes, I texted one couple things, right?
Oh. You go, Beth.
I have the doses.
So brave.
Initially, the Pfizer vaccine, I think it was about.
Bad.
That's it.
Didn't even flinch. Being on that ER team. Tough as nails.
And that's it?
That's awesome. Jenny, well done. Beth, thank you.
Thank you.
Good stuff. We'll see you in 28 days. Or 21 days. Which one's Pfizer? 21 days. All right.
So that we can take care of us.
Ace, how many decades have you been, well, I know 4, but how many years have you been a physician in the community?
They give you the
40.
vaccine. We also give them their vaccine, or document their
First of
vaccine.
January of the
Okay.
38 years.
38 years. I'm trying to help you take your mind off it. You got this.
I don't like shots.
I know. Good job. We're done? It's over?
It's over.
Done. Well done, Dr. Barish. That's awesome. No, we got a couple more to go. How many more to go, Lindsay?
You too.
2 more. The final 2. Here we go. So Jen serves on the OptumServe team. Over 400 COVID tests a day. And so Jen, thank you for being on the front lines of this with the community. And Taryn is on the RCS team, one of our crisis workers for the county. So number 9 and number 10, you are lucky 10, Taryn, the 10th one to get it in the county. Love it.
So, the fact that I've seen it twice,
You got this, you got this. That's awesome.
So exciting, it's so exciting.
How was it?
Fine.
Fine?
No problem.
Okay, you promise? All right. So we're gonna do that. Thank you for what you're doing
Yeah.
each and every day.
Definitely, thank you.
You will be safer, we're glad for it.
All right, thanks so much.
Awesome.
So you've just seen the first 10 people receive the new Pfizer coronavirus vaccine. And we're very happy and very proud to have it here in the community. We're working with our partners, with the hospital and with the clinics and so on and so forth, to be able to distribute it more widely as the weeks go on. Again, remember, our main defense against this virus is masks, distance, hygiene, ventilation, and please, even though this is the most painful thing I have to say, avoid the gatherings during this holiday season. We need the hospital capacity to be able to take care of our community who have COVID, or also people who may have a heart attack or a stroke. So please stay safe and stay well. It's going to be a different holiday season, but please make it a healthy holiday season so we can all enjoy next year. Thank you.
Probably should get a firefighter. But Chris will get it.